Hey everybody, it's Matt Shu from Upright Health. I'm joined today by my model Josh Hash. Today we're going to be looking at the Thomas test. So the Thomas test, if you're not familiar with it, is a physical test to see how your hip flexor mobility is. So the reason we're making this video is because I actually recently saw a sports medicine doctor kind of as an academic exercise, and the Thomas test was performed on me and it was really mind-blowing. So I wanted to share with you how the Thomas test can look when it's done in the not right way. So first we're going to show you pretty much the right way. We're going to take you through it real quick. So Josh is just sitting there on the edge of the table, and what he's going to do is he's going to shift so he's totally on the edge of the table. So he's got to have his butt like right on the edge, and then what he's going to do is even more on the edge, I think. Yeah, there we go. And then you're going to lie back. We're going to take this off. This is a prop for later. It's called foreshadowing. It's a theatrical thing, literary thing for all you majors, literature majors out there. So what you can do to make this, if you have two people, it's a lot easier, right? So for example, doctor. I'm not a doctor, but I play one on YouTube. So we're going to have Josh's knee flexed in towards his hip here. Sorry, I'm skipping a step here. He should have both knees up like that. So this is basically how the doctor set me up, grabbing both knees, and then one leg drops down. Okay, so when it drops down, you want it to basically get down past the level of the table, right? So we're looking at the angle between his body and the thigh. We want to make sure Josh is his lower back is flat down on the table. He's not arched super hard in any way, right? So if he's really arched, then he's cheating. He's not actually getting hip extension. He's just getting lumbar extension. So that's why we're trapping his leg here. Make sure that his lower back stays flatter, right? So he comes down like that. We want to look to see if his leg is abducting, if it's stuck up in this position, then we're seeing like, oh, okay, well, he doesn't really have good hip extension, right? If his knee were more straight and his foot were like higher off the floor, let's show him like that. If he had like really tight quads, he might be like that. So the Thomas test kind of shows you a bunch of different options. If it were like rotated like that, we'd have, you know, some sartorius maybe pulling on it. So a couple different things that can look wrong in the Thomas test. So if he's good, which pretty much he is, just maybe a little tight there, but in general, he's pretty good. He can get all the way down there, really good hip flexor mobility, then awesome, you get an A+. Now, here's how you can do the test wrong for anybody out there who's doing the test on other people. So I'm going to show you how the test was done on me. Super exciting, and I laughed a lot about this. So here we go. You ready? So first of all, I was sitting on an exam table that actually had an incline. So we're just adding a little bit of elevation here to this side of the table. And then Josh, you're going to slide up this way. So it's basically then sitting pretty close to this end with my back, my upper back elevated, right? So then you can already see there's hip flexion involved here. So now, Josh, I'm going to have you take both knees back towards your chest. And there was an extension on the edge of the table, so the doctor actually pulled out this extension that would just come out like this, so effectively making that table much, much longer. And then you can see there's going to be a little bit of a problem here if we then extend one leg out, and we want to check your hip flexors to see how much mobility you have. Are we even seeing hip flexor mobility? No. So this is actually how it was set up for me, and if you look at the angle here, we're still in hip flexion. Not only that, but now we can't even tell if there's any issue going on with quads. We can't really see anything about hip flexor extensibility. If Josh were super tight in this position, we would know that he had a pretty major hip flexor or anterior thigh issue. But for most people, putting your leg into a straight knee position with hip flexion is not really a useful test. So if this is how you're setting somebody up to test their hip flexors, you're not really getting a clear reading. What was really interesting was the doctor actually looked at this position on me and said, well, you've got really good hip flexor mobility. So that's out there. That can happen just because somebody out there is you know, a doctor, a therapist, a trainer, it doesn't matter what somebody is or isn't, whatever their label or title is, it is still possible to execute things in a way that completely negates the result. So this is a really clear example of how you could do the Thomas test in a way that gives you absolutely zero information. So we wanted to show it to you. If you're a trainer out there, if you're a therapist out there, if you're a doctor out there who is messing around with the Thomas test and trying to gauge what's going on with muscles, you should know that you can't block the leg up here like this and expect to get any useful information. So that's how you do the Thomas test wrong, and if you want to see how to do it right, you can of course rewind back to the beginning and watch us show you the right way. Hopefully you find this video helpful for you in whatever capacity you're going to use it in. If you like this video, remember to click like. If you like our channel, remember to subscribe and click the little bell next to the subscribe button to make sure you get notifications of all of our new videos. And find us on Facebook. Down in the description, you'll find the link. And always remember that pain sucks. Life shouldn't. If you liked the video, don't forget to like, share, and comment. And don't forget to subscribe.